Well, February is Heart Health Month. Joining us now is Dr. Alexandria Karazi with health tips for women. Good morning.
Good morning.
And I love that you're wearing your red, so appropriate and perfect. And I think that a lot of people don't realize that in February, this is what we're raising awareness for. Why is heart disease the leading cause of death in women? I didn't even know that until this morning when we were reading over all the notes.
Well, cardiovascular disease is actually the leading cause of death for both men and women in the United States annually. But specifically in women, it's responsible for 1 to anywhere between 3 and 5 female deaths per year, which is it's very prevalent. And there are a few things in addition to usual risk factors that make women more at risk, and we're more likely to present with atypical symptoms than men are. So rather than just the Hollywood heart attack where you feel the chest pain, you fall to the floor, and most people recognize that as heart disease. But in women it presents differently, right? So sometimes just with shortness of breath, fatigue, dizziness, heartburn, these symptoms that don't signal to women specifically that they have heart disease, and also sometimes even to providers when they go see them.
What are the major risk factors? Because I would think, someone would look at maybe their genetic history. My mom, my grandma, does somebody have this? But is there more than that?
Yeah, absolutely. So that's a big one. Family history, like you already mentioned, smoking, and then there's other modifiable risk factors as well. So high blood pressure, high cholesterol, diabetes among the major ones. But the good news is these are modifiable risk factors, which means that we can do something about them. We can start changing them early on.
And creating the awareness during a month like February is always about movement, maybe watching what you're eating. When you think about high cholesterol foods, what are things that we probably as Americans are eating way more than what we should be in a healthy diet?
Nutrition is very important, so I usually tell my patients stay away from processed foods, try to include lean proteins, fruits, vegetables, and also it's the proportion in which we eat. So moderation is a huge part of this. So for example, when I go to a restaurant that has large portions, I tell them to bring me a box straight away. So I just put half away and I only eat the other half. So that's just a simple small hack that even though I may be eating food that's not great, I get to at least eat less of it and balance my diet better that way.
And that might not sound fun to a lot of people who are watching this morning, but it's a lot less fun to deal with heart disease. So when you think about some of the little swaps that you can do, there are so many different things. Let's talk about some of the symptoms. Let's just say, maybe we haven't been at our healthiest. We have this in our as a risk factor in our history for our family. What are some symptoms that someone would feel, especially being a woman? You said it might be something that you don't even know that you have. So what should we be aware of?
Yeah, so chest pain is still a big one. So don't discount chest pain. And we see that depicted a lot in movies and shows. So awareness surrounding chest pain is pretty good now. But some of those atypical symptoms, so shortness of breath, particularly getting tired and short of breath beyond what you normally would. So I'll usually ask my patients, a year ago, did you feel like you were getting as tired as you are now? And if they're like, oh, I've really slowed down over the past year, that's a sign. Dizziness, heartburn, jaw pain, neck pain, really any of these symptoms within the right constellation of other risk factors, and particularly age can signal heart disease and definitely signal that you need to see your doctor for a heart disease workup.
What are the resources right now? You're with Sharp Grossmont that you guys are doing during Heart Health Month. What are some of the resources there?
So there's a lot of things that Sharp can offer. You can go to their website and check it out, and a lot of particularly community education and resources beyond what I'm saying here today. So I would encourage people to go look at that.
Okay, we'll link it all to our website as well. Thank you so much, Dr. Alexandria Karazi. I'm sure we'll have you on for much more advice later on this month, so thank you so much. All right, we're going to take a quick break. We will be